We are introducing you a little at a time to those who are asking for your vote for U.S. Senate, and we have a candidate in the studio with us this morning I want to introduce you to. He is Dr. James Buckmaster, was born in Henderson, Kentucky, one of 8 children, attended Brescia College in Owensboro from 76 to 1980, graduated with honors. In 1980, he attended the University of Kentucky School of Medicine, finished his medical school training in 1984, and he completed a 3-year residency in family practice, returned to Henderson in 1987, where he currently lives. For the last 13 years, he has owned and operated the Corpus Christi Clinic, a walk-in clinic for the working poor, the uninsured, and the underinsured. He's the father of 8 children, 5 girls, 3 boys, and the faithful husband of Marcia Buckmaster for the last 28 years. And Marcia's also in the studio with us this morning. Dr. Buckmaster, good morning.
Good morning.
Welcome.
Good morning.
Welcome to Lexington.
Thank you. Glad to be here.
What would a nice guy like you want to be getting into a profession like politics? This is your first time, right?
Yes, it is.
Seek office.
Yes, it is. The main thing is just a sense of duty. Things just don't seem to be right out there, and I was looking at my kids, and I was wondering what kind of future they had, what was laid out there for them, and I kept waiting for something to happen, someone to get in there and start to do it, and finally I decided that maybe it was me. I needed to get in there and try to make a difference in the community and for the state and for our country.
Have you ever had political aspirations before this?
No, I haven't.
Really?
No.
Never thought about that. One day maybe I'd like to be in politics.
Absolutely not. That's the last thing from my mind. I'd rather be out working my garden this spring.
How do you classify yourself from the conservative to liberal scale?
I'm a conservative.
You're very conservative?
Yes, very conservative.
Would you say far right?
No, I wouldn't say that. I'd say,
pretty much on the conservative.
Pretty much on the conservative side, not extreme right, but.
All right. I want to ask our callers as we go along here, if you have a question or comment for Dr. Buckmaster, he's here to talk to you and answer your questions at 253-5959, star 590 from AT&T, toll free from anywhere, 1-877-777-0590, email Jack Pattie at WBLKAM.com. What's if you had to name one thing that you think is key, I'm not talking about just to the race, but I mean to the country right now. What is it?
Well, I think the main thing is the national debt. That's what makes everyone afraid. Fear tends to motivate you. Either you run from it or you run into it and try to take it on face on. And that's kind of the approach I take. We need to get the budget balanced, and we need to get rid of this national debt that seems to make everyone just that background. Just gnawing fear that you have that something just isn't going as well as we think it is.
How would you like to see that? How do you propose that we do that?
Well, I think what we have to do is begin to work on a balanced budget and make these things real. Make it so that we have to keep ourselves living within our means and try to cut taxes and get for the corporations and get our jobs back, get people working, and get the economy going.
Let's talk about cap and trade. What is your opinion about that?
Job killer, job killer. It's going to be bad for Kentucky, and it's going to be bad for the country, and it's going to be terrible for jobs. Cap and trade is based on bad science, and there's no reason that we should even be moving toward that direction at all.
All right, can you be more specific?
As far as the cap and trade,
the bad science.
Well, it's based on the carbon credits that they had talked about, and blaming us for the global warming, which is falling apart daily. The scientists behind it are even beginning to confess that they have manipulated the data, and there's no way that this is going to hold water. People are going to have to look at the cap and trade again and just scrap it and say this is not based on logic or on good science at all.
What about our health care system? What direction would you like to see us go in that regard?
Well, I think there's a lot of people out there that do not have health insurance, and I deal with them every day.
Yeah.
We have not done anything for them for the last 10 or 15 years, and I've seen them come in. They don't have insurance, or they have to pay $750 or $1,200 for their premiums, and so they drop it. And these are people that are working. They have small businesses, and We have to do something to help them, but there's not 40 million of them out there. I agree that there's about 10 million of them out there, and we should be able to provide them with a low premium, high deductible policy that we could pay for them for any time that they hit expenses over $5,000 a year. Then we can start taking over for them and help them out so they don't feel the fear of bankruptcy that most of them feel.
Tell us about your specific practice that we mentioned in the introduction.
My practice has basically been there for 13 years. We've been an outreach in our local community for people who are underinsured or uninsured. Until last year, we did not take any insurance except for Medicare. And so people would come in and they would be seen in 2 or 3, maybe 5 minutes as a walk-in clinic. We were able to take care of them in a very cost-effective manner. Our prices were somewhere in the range of 60% less than any other walk-in clinic in the community. So we gave them a service, and it was at a reasonable cost, but not. It wasn't free, but it was at least reasonable. It was my gift back to the community to try to help those that were suffering and being ignored by the government and by the insurance companies.
Okay. Good morning. You're on the air.
Good morning. Yes, sir. I would like to ask you, what was the last book that you read?
The last book that I read. Well, let's see. I'm trying to think. I read one that was called Arguing with Idiots. That was one that I liked with Glenn Beck. That's the last one I can recall. But it's with 8 kids running around the house. You don't have a lot of quiet time to sit and read.
Well, how many books per week do you read,
sir?
sir?
Like I said, I don't read a total book each week. I've been busy with campaigning and with the children and with my practice, and I don't have a lot of time for enjoyment reading and things like that.
Well, I'm talking about reading nonfiction that would help you in your roles as a representative of our people.
I see what you're saying. Well,
do you have a website where we can research?
Yes, it's Buckmaster2010.com.
Could you spell that?
Yeah, Buckmaster 2010.com.
Thanks for calling, Thomas. 253-5959, touch star 590 from AT&T. Toll free from anywhere, 1-877-777-0590. Email Jack Pattie at WVLKAM.com. And do you consider most Kentuckians who are Democrats to be conservative?
Absolutely. You look at our state right now, we have 2 Republican senators, and they depend on the conservative Democrats to get them in office, and they know that very well. And so do the Democrats here in this state. We have a lot of us out there, and many times they say, well, there's not many of you there, but I think they're looking the wrong way.
John.